Okay, I'm Dr. Bertilson, and I will show you the typical signs of a patient with patellofemoral pain syndrome. And this actual patient has drawn this little drawing. It's bilateral pain in both knees, most commonly experienced while she's running or even when she's doing just sitting. And now we will examine her. First phase is just to look at her knees, and we can find here that she has a well developed muscles. There is a slight decrease in her soleus muscle on the left side, and she's also trying to stand with her left feet a little bit more relaxed, or it's not the same position. Okay, we will go forward, lay down, and actually we'll restore. So her drawing indicates that she has a little bit more difficulty with the left knee, so we will start examining the right knee. And just, if you can relax, and we'll do the McMurray test. Test for the stability, looking at the patient's facial expression. You can note if there is any pain, and it's obviously not painful. The patella is just ordinary moving. Now, if we palpate here, there is no actual pain spot unless we go there. That's a painful spot. 5 o'clock of the patella. Now let's try on the other side, the more painful side. Once again, movement of the knee is just fine. The joint is stable in all faces. Now we're getting close to something very painful. She's reacting, and once again, if we go there, you don't want to. No, you don't want me to be there. At 7 o'clock, there is something painful. Though the rest of the knees just fine. Okay, we'll continue with some palpation of the, and here is something that's painful. Is it painful there?
Just a little.
A little. And on this side?
And it's much more there.
Much more painful. You don't want me to.
No.
And we can go all the way down to that area. It's painful on both sides. That requires some thought. And maybe we should go up a little bit. And this left side, it's painful all the way down here. Some of you already understand that this is the only thing that goes that way is the nerve. So we should actually tie the nerve system and pull downwards, push towards my thumb. Pull upwards. She's very strong, though on the left side she has to try to take, it seems like you're trying harder to keep the toe. And we'll try the L4 muscles. You keep this leg straight, and that's somewhat difficult.
Yes, I heard a little bit also.
Yeah, there was a small crack. On this side, keep the leg straight, and that's very difficult, huh?
It's not
very difficult. Why is it difficult?
Because I feel pain under here.
Under there. Somewhere here. lay down. And what about if I do like this? Is that okay?
Yes, no problem.
No problem. No problem. What about if I touch like this? Is there a difference, right to left?
It feels a little bit more on that side.
You can feel my fingers.
Yes.
And what about here?
It feels a little bit more on that side.
Still more on this side. What about down here?
I feel more on that side.
It's more. And then that was the test for the myelinated nerves, and then we will try the C fibers. What about that?
I feel this side more.
It's more.
I don't feel that side so much.
Don't feel that side so
Not
much.
so much, no.
What about down here?
I feel it's much more that side is.
How much? So there's a clear difference in sensibility, and of course we should go upwards. But okay, we will maybe even try on the stomach. Is there
It's a little bit different.
less difference? Less difference. So we will need to ask you to turn around. And lay down. And from here we will examine just a little bit the spine. You tell me now if there is any painful spot coming down
A little.
right there. And then we are at the L4 level. And what about there?
It feels more like it's hard.
It's hard. There's some resistance to my
Feel it there.
L5, S1 is also painful. And what about if we go side to side? There it starts to hurt again. On the left side there is a resistance to my, on the L4 and the L5 you don't want me to let, it's a little bit less so on the right side. Thank you. Thank you.